Hey, good morning and welcome to the UroPatient podcast. I'm your host, Vic Sinise. Nice to have you on board. If you're watching us live, we come to you every Saturday at 10:30 a.m. Central Time, and we're live available on YouTube, Facebook, and X. So you can check us out anywhere on those channels, and you can subscribe, like, and follow, and all the other good stuff on all those channels too. Hey, if this is your first time checking us out, be sure to go to our website at UroPatient.com, where you can learn more about the show, watch past episodes, and we got these helpful handouts that you can get. So be sure to check all of those things out. Now, this week we got a great episode for you. I thought it might be a good time to visit this because I've had a lot of anxious patients coming in for prostate biopsies. Getting ready for a prostate biopsy? Watch this first. So we're going to get right into it and show you what you should and shouldn't worry about with the prostate biopsy, and getting ready for it can make a big difference. So this is the presentation I was just talking to you about, preparing for a prostate biopsy. Today we're going to discuss what the procedure entails, how to prepare for it most importantly, and what to expect during and after the biopsy. So prostate biopsy is a crucial diagnostic tool that allows us to examine your prostate tissue under a microscope to check for cancer and other abnormalities. So we're looking at the actual cells themselves. Now, your healthcare provider may recommend a biopsy based on specific findings. Often these are found during routine screening or imaging studies. Such things as that PSA blood test comes back abnormal. That could be a reason to check you out and have a biopsy. Or sometimes it can be the digital rectal exam was abnormal, or just something came up on an imaging study. Any of those things are good, valid reasons to want to do this. Now, each type of biopsy has its own unique features and may be recommended based on your specific condition and available resources. Now, out of those, the transperineal biopsy is the one where you go through the skin underneath the scrotum. Transrectal ultrasound, which is kind of the gold standard, still what most of us are doing, is where you go actually and penetrate through the rectal wall using an ultrasound probe to guide this with a small needle and taking the samples. An MRI-guided biopsy tends to be reserved for patients that have a lesion that shows up on an MRI, because this can very highly accurately focus on that lesion. Those are done also through the rectum generally. So different ways to approach the prostate all have very similar results as far as getting good results in biopsy samples. Now, this is what we're really here to talk about: proper preparation that can minimize your risk and ensure a smooth procedure. Now, always follow your doctor's specific instructions. I'm here to talk about what we actually kind of recommend for our practice. It can vary practices to practices, so you can see some variation, but you want to discuss your medications with your doctor. And I mean, you need all your medications so we know what you're on. Discuss blood thinners if they're stopping your blood thinners if it's advised, and arranging for transportation. Sometimes this is done under sedation or something that would require someone to drive. Sometimes, most of the times we do them under local anesthetic, which would allow you to drive. Always recommend bring somebody though, because you just never know how you're going to react to the stress of it. Everybody's a little different. So I've had patients pass out getting the blood test. So, it varies patient to patient. I think it's always a good idea to have somebody there to drive you. Now, certain medications increase your bleeding risk. These are the blood thinners. Your doctor will most likely advise you to temporarily stop them. I got to tell you, every one of these blood thinners, and those are just a small list of the many of them. I mean, it would cover pages of all the different blood thinners out there. But each of them have a different amount of time you need to stop them, and that's important. So some have to be stopped up to a week, some only a couple of days. It's important that you follow the instructions about blood thinners and stopping them, when you should stop them. More importantly, things like herbal supplements can sometimes cause your blood to be thinned out. Things like vitamin E, some of these herbals, make sure we know what you're on, over the counter. Aspirin's over the counter, ibuprofen's over the counter. Both pills can thin out your blood. And any of your other regular medications, for some reason, they may have something in them. So always coordinate with your doctor's office to make sure they know what meds you're on. Now, I will tell you with blood thinners, it's really important. You're on blood thinners for a reason. most of the doctors' offices, ours included, coordinate with whoever's prescribing it to find out about what you need to, how long you can be off them, how safe it is to be off. Everything in medicine is a risk benefit. So we want to get the sample as safe as possible. They want to keep you from having a heart attack or stroke. So it's very important that we have a balancing act and do what's safest for you. So expect some coordination. Many times you can be off those for short periods of time without any complications or problems. Some people can't, and they have special drugs that we can utilize so that the blood thinners are stopped at a very short period of time and you're resumed very quickly too. So again, your doctor should be advising you what's best for you. Now, this is the other thing, dietary prep. I have a lot of patients come in who have fasted. I don't know why. Our instructions say not to. Now, depending on the procedure your doctor's office is going to use, maybe they want you to fast. But ask that question, because one of the biggest problems I have, especially in patients that are diabetics who fast, they take their diabetic meds and they drop their blood sugar. So we recommend that you have a light meal, meaning you could probably have a bowl of cereal in the morning, anything, that kind of gives you a little bit of energy boost. Don't come in starving, because it doesn't help you out, and drink plenty of fluids. There's no reason why not. What we don't want is to have you feel like you have to move your bowels because you had a great big giant, the Denny's Grand Slam breakfast. But it is a good idea to eat unless you're told otherwise. And then we normally we use a fleet enema. There's all sorts of bowel preps that can be utilized. Some doctors' offices don't use them. I was giving a lecture internationally, and the Brits came over and said, "You Americans and your bowel prep, the enemas, that you can't prep a bowel." And they're right, you can't. The enema does not make your bowel sterile. What it does is it makes sure that there's no stool right in the opening, so that we don't have to cancel or postpone your procedure. Now, of course, in England they're less worried about that, I guess, so they don't really use them. But it depends. Again, I can't stress enough, be hydrated. You don't want to come in a bad shape for your biopsy. There's no reason for it. And again, most of the time you can have a light meal. That's perfectly fine, and all the fluids you want. Antibiotics are always used before a biopsy to prevent post-procedural complications. One of the risks is getting an infection. We can't sterilize. I just mentioned you can't get the bowel sterile, so you're sticking a needle through generally contaminated bowel, and it's a risk that you could put bacteria into the bloodstream, and that's something called sepsis, which can be life-threatening. Now, to avoid that, we use antibiotics so that they're on board, killing off the bacteria as fast as it gets in there. Thankfully, 97% of the time, that antibiotic is perfectly there to help prevent it. 3% of the times it can fail. There can be some patients that have a resistance, an organism that's resistant to the antibiotics, which is really important. Now, you might say, why don't I just get pills? Some doctors' offices are giving pills. Some are giving you a shot. Some are giving you an IV. It varies depending on where you live. The doctors typically use something called an antibiogram, which tells them in their local area what is the best antibiotic to use, because you want to get the one that's going to have the best treatment to kill off the bugs that are found in the bowels. So you will receive antibiotics, whether you take them orally ahead of time or just get a shot in the office or an IV in the office is up to your doctor's office. And a lot of the antibiotic injections, the ones that we use, cover for 24 hours and don't require additional antibiotics afterwards. Some do. So again, talk to your doctor, make sure you're aware of what antibiotics you're going to need to be on. And important, if you're allergic to something like penicillin, make sure they know about it, because it's important. We don't want to give you something you could have an allergic reaction to. Now, having these items ready ensures a smooth check-in process and minimizes stress on the day of the procedure. Photo ID, your insurance cards, all that stuff that you need to have anyway. Comfortable clothing. Some patients come in and they're wearing, stuff that I don't think is all that easy to get on and off. I actually have a trick in our office, because I try to make it as simple as possible. We don't have patients to actually undress for the biopsy. Now, other doctors' offices are going to do it differently, but really all we need you to do is drop your pants halfway down to get access to where we're going to go. I think patients tend to feel like it's a less invasive procedure if they don't have to get completely undressed. It seems to work in our office anyway, but Everybody's going to do it differently. Now, here's the big thing I want to talk about. List of medications and allergies. Your doctor's office, the day of the procedure, should be reviewing those. Now, sometimes the patient may have come in with the PSA a month ago, and then it's been a month later that we're getting in for the procedure. You may have been started on a new medication between now and between when you first came in and when you're actually getting the biopsy done. Maybe whoever did your history didn't get all the meds written down or skip something that could be very essential. Maybe you forgot to tell somebody, what meds. Have that list again. I'm telling you right now, this is what I do. I talk to the patients ahead of time. I make sure they're ready for the procedure. Number one, I recheck their allergy list. I can't tell you how many times I found allergies that were wrong. Sometimes the computers now with all this EMR, it's easy to hit a button and have something pop up that doesn't make sense. So it should be rechecked. That list of medications, I'm serious. I'm going to go through all those medications with you. Not only the meds that I see on the list, I'm going to say, have you taken any aspirin in the last 7 days? Have you taken any ibuprofen or Motrin in the last 7 days? Any medications that could thin your blood, and I'll look at the list that they're on. I've had patients that have told me, oh yeah, that's right, I was on a blood thinner, I forgot to mention it. These are important. We don't want to go ahead and have unforeseen bleeding because we didn't know you're on a blood thinning medication. Better to cancel and come back instead of having to have a catastrophic result. Now, the biopsy is typically a quick, minimally invasive procedure. You may feel some pressure, but you shouldn't experience significant pain. And I'm here to tell you that, I have never had one done, but I've been assisting with, probably, I don't know, could be the tens of thousands, maybe 100,000 of these. I've done a lot of them, 40 years. But one of the things I'll mention is, we always give a local anesthetic, and that stuff really works well. Once the doctors are trained in knowing how to give the blocks, which we didn't years ago. So sometimes if you talk to somebody who had one a long time ago, it may be a different story. But with the proper block, you're not going to feel hardly anything. Also, they can use things like these breathable anesthetics called Pronox or nitrogen oxide that you can use. It's kind of a quick, make you kind of groggy and helps. So those things can be done. Procedure is going to take, it says 30 minutes. That's start to finish. I mean, that's getting you to sign your consent, going through your pre-medicines, giving you your antibiotics, all that stuff. The actual biopsy itself really should be 5 minutes or less. It's really, really fast. Now, what you can expect during the biopsy. So mild pressure, mild discomfort, minimal bleeding is normal. You're going to see a little bit of blood. That's normal. And again, the healthcare team is there to check you over and make sure everything is fine before you leave. Again, the anesthesia should make that a piece of cake. One of the things that I like to do is I talk to patients during the procedure, find something they're interested in. We're from Chicago, so there's usually some sports team in Chicago that's not doing very well. So we always got something to talk about. I find that is a great way to keep people's mind off of things. I always have music playing, and I always try to look at the age of my patients and kind of pick something that fits the generations. I got this new thing called yacht rock I've been playing quite a bit. People really like the music. So whatever it takes to kind of get your mind off of what we're doing, it's going to make it a lot easier. Now, post the procedure, recovery is typically quick. Typically we're not using anything more than local blocks for most of these. You can almost get up right away. Generally, I take and let patients kind of relax a little bit, because some patients are going to be a little, apprehensive from having it done. But, long as you check out, there's no active bleeding or anything like that, you're almost up right away. Now, for the rest of the day, I always recommend patients take it easy. Some patients will go out and do crazy things. They'll go to the gym and work out. Not a good idea. Rest for that day. If you're working and you're kind of in a sedentary job, probably can do that. If you're type of job where you're lifting things and stuff, take that day off. You want to avoid strenuous activities. You want to drink plenty of fluids to help to keep any blood that might be coming into the urinary stream out, to help flush that out. That little bit of blood's perfectly normal, not to worry about it. Now, there are possible side effects, and they're usually temporary. If you're concerned, contact your healthcare provider. They're going to I'll tell you how much concern they are. But mild pain and discomfort, Tylenol generally is all you should need for that. You shouldn't need any strong narcotics. Blood in the urine, stool, or semen, absolutely, you're going to see a little bit of that. If it's blood that's dripping out of your rectum and it won't stop, that's excessive. And then the rare risk of infection, as we mentioned earlier, if you were to get a high fever, 101, 102, shaking chills, that type of thing, let us decide what you're going to do. Call your healthcare provider. Let them make the decision. These signs could indicate complications, so don't hesitate to seek medical attention. As we mentioned, that high fever and chills, the heavy prolonged bleeding, difficulty urinating. Some patients have gone into retention. The prostate, if it was pretty big and blocking you to start, and now it swells even more from the biopsy, you might not be able to pee. So you got to give us a call. That's a pretty rare one. I don't see it too often, but it does happen. Now, one of the biggest things is waiting for your results. You do need to wait and get those. They don't come instantly. There's a process that's used to look at these under the microscopes. They do some what's called staining so they can see the cells better and stuff like that. Generally, be prepared to wait 1 to 2 weeks, and it's different depending on where you're at and how close they are to wherever your samples are going to. But they're going to go out to be reviewed by somebody who's trained in pathology, looking at these for cancer. And then this is a more important thing. Make sure you got a follow-up appointment. Don't just think no news is good news. Worst thing you could do. I thankfully have never seen it in our practice, but I have read about certain lawsuits that came out because patients weren't informed of their biopsy results, somehow slipped through the cracks, and they never came back. The office never noticed that they didn't come back, and they come back a year later and to find out that they had missed their results and they had prostate cancer. So, take some responsibility yourself. Make sure you come back. You should have an appointment to follow up. Some can be telehealth, however your doctor's office is doing it. You need to hear the results from the guy or girl who took your sample. So following these recommendations can help ensure a smooth recovery. Resume normal activities gradually. Don't go right to the gym the next day. Maybe just work out a little bit and see how things go. Again, avoid heavy lifting. Sexual activity, again, I'd lay off of that for a few days. If you're bleeding, don't go do any of these things. It's not going to get better. So if you're having, kind of more bleeding than you think you should, lay low. All right. Open communication with your provider is the best thing. Talk to your provider, whoever did the biopsy. If you've got problems, call the office. Let them kind of go through it. Most offices have, somebody, doctor on call, or the nurse that's taking care of this, or a nurse practitioner. Somebody's going to be there to relieve your anxiety and make sure everything's going okay. There is some emotional support things that you can look into. Don't hesitate to seek support by talking to friends or family. Talk to someone who's already had one done. Now, this is one word of warning. I don't know what it is about guys, but some guys like to tell the patients the worst case scenario. Oh, this is terrible. It was the worst thing I ever had done. Oh, maybe it was, but everybody's going to have a different person doing it usually, who may have a better, technique, which could be less painful, better anesthesia, blah, blah, blah. So don't rely on your friend's horror story. And some of them, I just want to make their buddies nervous. I don't know why. Now, again, I'm not trying to underestimate that it could have had a bad result, but not everybody has a bad result. So I'm not a big one on talking to friends. Now, the other thing is, hey, I'm on YouTube, right? I'm on Facebook. I'm on X. Some of those programs are good. They're good supports. You can get misinformation, though. You have to be careful, kind of feather through your results, because sometimes you're going to get, patients who are going to tell you the worst thing that ever happened, and maybe those horror stories are true. Maybe they're not. And if it doesn't happen to you, it's good. Now, I always kind of say, when it comes to side effects, low risk, 97% time, you're going to be fine. 3% of the time, you may have a more, concerning complication. But I always say, if you're one of those 3%, that's 100% for you. So don't think there's no such thing as a no risk procedure. There's always some risk. There are support groups out there. And again, professional counseling, and talk to the guy who's doing it. They can tell you how it is in their hands, what patients typically say. So key takeaways: proper preparation will minimize your risk, decrease your discomfort. Following those post-op instructions are going to be a big plus. There are some on our site you can follow if your doctor's office doesn't give you any. And communicating your concerns with the healthcare team is huge. Always have that open line of communication because you're going through this. Hey, hope you enjoyed that episode. And like I said, it's not something you need to get too worried about, but I've had a lot of nervous patients. I thought I'd put this one out just for you guys. And remember, good preparation is important. So we'll see you next week on UroPatient Podcast.